Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. NIK NIKAM, a cardiologist from Houston. In this presentation, we're going to talk about high blood pressure and how to look for side effects from high blood pressure medications. So let us begin with the feature presentation. Whenever someone has blood pressure, they may be on 1, 2, 3, or a combination of medications. And each one of these medicines have significant side effects. We're going to look at the side effects of each class of drugs. Then at the end, I'm going to look at the effects of a combination of medications that can adversely affect your everyday lifestyle. So let us begin with the first blood pressure pills that we talk about normally, which is diuretics or water pills as they are called. They mostly commonly hear them as Lasix, hydrochlorothiazide, or chlorthalidone that are used for high blood pressure management. And most of these water pills help to excrete or eliminate water, salt, and potassium from the blood through the urine. As a result, people can get dehydrated, they can have low potassium levels, they can feel weakness, some people may have muscle cramps, and some people may have worsening of the kidney function. And because of loss of water and electrolytes, patients may get dehydrated if you're on large doses of diuretics. So you're going to need a periodic blood test to make sure your kidney function is okay, your electrolytes are okay, and your potassium level is okay. If the potassium level is too low, your doctors may prescribe you a oral potassium pill to go along with your diuretic. Again, the dosage of diuretic has an effect on all these parameters such as electrolytes, kidney function, and potassium levels. Make sure that you follow up with your family doctor when you are on diuretics because they can cause significant side effects. The second group of drugs that we use for treating high blood pressure is known as the ACE inhibitors or angiotensin converting enzyme inhibitor, which basically relaxes the blood vessels and reduces the blood pressure. The most commonly used drugs are known as Vasotec, Ramapil, Lisinopril. You have heard these names. And some of the side effects of these drugs are dry cough. These drugs have an effect in the lung tissue which releases bradykinin, which causes dry cough, which may be helped with some cough syrup. It also can worsen the kidney function. Some people have elevated potassium levels. In the diuretic group, we talked about low potassium level, and in the ACE inhibitors and ORBs, which we're going to talk next, there can be an elevation of potassium levels, especially in patients with marginal kidney function. Some people can have an allergic reaction or angioedema, like a serious allergic reaction on a first dose basis. And occasionally, people may spill some protein in their urine, and all of these things need to be monitored by your primary physician or the cardiologist with blood tests to make sure that you're not having side effects from the medications that are supposed to help you control your blood pressure and reduce long-term risk factors for heart disease and stroke. The third group of drugs I want to talk about is known as the ORBs or angiotensin receptor blockers, which is similar to angiotensin converting enzyme inhibitor, but it acts at the receptor level. And the drugs that are commonly used are known as losartan, valsartan, candesartan, or olmesartan. The last few letters, sartan, if it means sartan, those are all ORBs. They act in a manner similar to the ACE inhibitors, except they don't cause the dry cough because it has no effect on the lungs in producing bradykinin, but nonetheless, they can worsen kidney function. Especially when they are given for the first time, we monitor their kidney function before and a few weeks later because their kidney function can get worse and it may stabilize after that. There can be swelling because we dilate the blood vessels, there's fluid accumulation, and anytime you're on one drug or more than 2-3 drugs, it is not unusual for people to develop fluid retention, edema, for which you may need diuretics. Just like the ACE inhibitors, ORBs also can elevate the potassium level, especially in patients with marginal kidney function or patients who have kidney failure. So if you have a combination of these conditions, it needs to be closely monitored by your specialists like cardiologist, nephrologist, or the primary care doctor. And some of these drugs can drop your blood pressure when you stand up because they dilate the blood vessels. As a result, you need to change your position slowly or exercise your legs while you're sitting down or lying down before you suddenly stand up. And if you feel dizzy, make sure you hold on to something and then get back to the reclining position. Calcium channel blockers are also commonly used for treating high blood pressure. The drugs that are most commonly used that you may have come across are cardizem, amlodipine, and a couple of other ones. The calcium channel blockers, just like the beta blockers, they slow the heart rate. They cause headache, dizziness, weakness, fatigue, and they can potentiate the effects of beta blockers in terms of reducing the heart rate and causing conduction disturbances. Calcium channel blockers, because they reduce the heart function, can worsen patients with heart failure. It also has effect on the liver and kidneys. So these are some of the side effects which we need to keep in mind. And let's talk about beta blockers, which are most commonly used for treatment of hypertension, for heart disease, for cardiac arrhythmias. So this is one of the most commonly used drugs by cardiologists. So we need to know a lot about the side effects from beta blockers. First of all, beta blockers reduce the heart rate. They reduce the contractility of the heart. As a result, they can slow the heart rate and sometimes cause heart blocks. They also cause irregular heart rhythms. They may also cause dizziness and weakness, and because they block the sympathetic system, people may feel with fatigue. Some people may experience sexual impotence or inability to get an erection. And patients with lung disease, asthma, chronic obstructive pulmonary disease, who have a tendency to have airway obstruction may develop bronchospasm when we give beta blockers. So we need to keep all these things in mind. And finally, when we combine these drugs like beta blockers, ACE inhibitors, ORBs, alpha blockers, water pills, then you are talking about a combination of side effects affecting you more so than controlling your blood pressure. That is why titration of the dosages, the timing, and the drugs must be carefully monitored. For example, if you use alpha blockers, which blocks the alpha receptors, then there is unopposed action of the beta blockers, which is the sympathetic reactivity. So if you are just on like an alpha blocker, then you can have an increased sympathetic activity, and that's why it needs to be combined with a beta blocker. Similarly, when you use a combination of drugs, you need to watch for potassium, you need to watch for fluid, you need to watch for hypotension or changes in position that can cause low blood pressure. So these are some of the things we need to keep in mind, because management of blood pressure is a lifelong process. It is a constant readjustment, just like the pilot sits at the cockpit and constantly monitoring for 16 hours of cross-country flights. We have to continuously monitor and adjust the dosages, follow up with your doctors so you don't have side effects from the drugs that are worse than your blood pressure itself. I hope this has been useful to you, and we have been talking about blood pressure medications and their side effects. Thank you so much for watching. I am Dr. NIK NIKAM, and I will see you in the next presentation. If you want me to research on a particular topic, please let me know so I can do the research and get you the right information for your knowledge. I will see you in the next presentation.